Thank you, Minister. Through the chair, I'm wondering. I mean, health obviously has a very large budget, and I am always glad to see an increase in the budget towards mental health and addiction. However, the percentage of the total budget still for mental health as a proportion of the whole budget still isn't as high as like the Canadian Mental Health Association recommends. I'm wondering if the minister can speak to why government is not able to I guess meet that target. How is that decision made for to not have a larger allocation towards mental health?
Thank you, Mr. Chair. Through you to the member opposite. We recognize that we are still below the Canadian average, but one of the reasons that we put so much energy into the 5-year Addictions and Mental Health Action Plan is so that over time we can certainly build up those financial and human resources to give mental health, the attention that it needs and deserves. And I should also say that with our investments that we're making, we're not just taking a pool of money without having an action plan for it. Mr. Chair, we've been very cognizant of the fact that we need to be spending wisely, and we also need to have a plan when we make money available. And that's what we've done till now, and we'll have more coming as even this certainly this year progresses. The other thing that we've tied to the budget amounts are outcomes and measurements, so that we can be assured that the services that we're delivering are the very best that we can deliver to the people of New Brunswick and support individuals in mental health and addictions challenges and their families. And so we have put accountability measures within these programs so that if we need to change, if we need to pivot, if we need to refocus, we can do that as we progress.
Thank you to the minister through the chair. Certainly, I would agree it isn't enough yet. I do hope that we do see increases, and especially in investments in terms of the human resources that are needed to help our health system function. We see on a lot of fronts that there are shortages. I know that the minister is well aware of that, and I think many people in New Brunswick have been aware of that for a long time. This isn't a new issue that snuck up on us. And so I'm wondering, can the minister speak to how much additional funding exists in the budget in order to hire addiction and mental health staff?
Through you, Mr. Chair, to the member opposite, and thank you for the question because it gives me an opportunity to clarify and build on what I've said earlier. So the 559,000 under the addictions component of addictions and mental health, there's also 7.73 million in our mental health segment. So as these not just for human resources, but also for programs, et cetera. But before even most recently, we had another 6 FTE positions slated for licensed counseling therapists, and also that we would be utilizing our NGOs to our maximum potential. Knowing that they're boots on the ground, knowing that they're very in tune with their communities, and that we will line up our agenda with theirs or theirs with ours in order to ensure that we're delivering the most comprehensive and accessible services that we can throughout the network. There are going to be more FTE announcements as we progress through our crisis care initiatives that are ongoing right now, but we do have budget for those.
Thank you, through the chair to the minister. Is it possible for us to have an idea of how many FTE positions are slated to be announced, and what that looks like in the budget?
In all sincerity, we are still pulling that together and finalizing those details. So while it is coming very soon, I cannot commit to it today for you.
Thank you, through the chair. All right, cross off that question then. I guess we're talking about right now mental health professionals. There are many other professionals that need to be hired. I'm wondering if the minister can speak to how this budget helps lay out a plan for ensuring that the shortages get addressed. I'm wondering, is there additional funding and in order to hire nurses, in order to hire midwives, nurse practitioners? Can you speak to what healthcare professionals the budget allows to hire, and any specific numbers are always appreciated.
through you, Mr. Chair, there are a lot of initiatives going on with regard to recruitment and retention of medical professionals, and there are many different categories of what we need. So just off the top, and if I miss something, the member can certainly follow back with me to see, but I'm going to give you what I can. So with regards to physician recruitment and retention, we have a $5 million budget. That goes to specifically right now 2 programs with regards to recruiting. We have one for urban and one for rural. And of course, the rural physicians, there's an $80,000 bonus, if you will, for agreeing to be to take a 4-year contract in our rural areas, $20,000 in urban areas. We have, for our health workforce planning, we have $11.1 million budget. That is to target 105 positions, 40% which would be family physicians and 60% for specialists. Allied health professional resource strategy, so psychologists, of course, are make sure I have the right page here. Yep, psychologists, of course, is one that we are working very actively on, and it's an increase. That's a $351,000 budget. Oh no, I'm sorry. It's so that is correct. And nurses, the nursing resource strategy. So I have to give a shout out to our friends at Post-Secondary Education Training and Labor, because they're certainly a part of this with internationally trained nurses and bridging programs that they've put in place. And that budget is at $5,557,000.
Thank you, through the chair, to the minister for that information. I will follow up, I guess, with a few other positions. I'm wondering, are there any plans in terms of hiring more midwives? And I'm also wondering about nurse practitioners. How many nurse practitioners have the RHAs asked for this year? And how many are being hired in this budget?
Thank you for giving us the time to just pull those numbers together for you, and Mr. Chair, through you to the member opposite. So with regard to midwives, we've had a demonstration project under Horizon, and we've had 4 midwives working under Horizon throughout this area. And if COVID hadn't happened, that review would have happened this past year. So it hasn't been reviewed yet in order to expand. But what I can say is that with nurse practitioners, we've included 23 additional positions over this past year. We have 159 registered nurse practitioners in the province. Approximately 138 are working as midwives. And as may have heard in the media recently, we have 18 vacant nurse practitioner positions under the regional health authorities. And we would hire them today, if I had them coming forward. Thank you.
Thank you to the minister through the chair. I guess I'd like to seek clarity on what was just said about, I think I heard the number 138 are practicing. Did I hear it? Can you please repeat that? I don't know what I heard.
So approximately 138 of the nurse practitioners are actually working as midwives. Oh, I'm sorry, as nurse practitioners. That is my mistake. Yep, thank you.
Okay, thank you for the clarification. I thought I heard midwives and was not was surprised by that program. Okay, so I'm wondering. And I believe the minister said 23 being hired this year. Perhaps the minister could clarify how many in Vitalite and how many in Horizon. And I'm also curious, how many patients is the department expecting to remove from the wait list? As the minister is well aware, there's a long wait list of people waiting for primary care practitioners. How many are anticipated to be removed from the wait list based on the plans around hiring nurse practitioners and based around plans for hiring additional physicians? Thank you.
Through you, Mr. Chair. So the nurse practitioner positions that are open right now, there's 5 with Vitalite, 11 with Horizon, and 2 with the extramural ambulance New Brunswick system. Each nurse practitioner under the Horizon Vitalite network would build their practice up to remove 1,000 patients from the Patient Connect list. As you know, we have the family physician recruitment going on. And, but over the past weeks, we have removed 9,200 plus individuals from the Patient Connect list.
Thank you to the Minister through the Chair. That's always good news to hear that people are being moved off that list and receiving primary care. That is a huge problem across the province, and I know people who have been waiting for years and years, even when they have serious medical conditions that need continuous care. So I am glad to hear that. I'm wondering, in terms of the recent changes, in the new budget no longer funding diagnostic and laboratory tests ordered by the nurse practitioners who are working outside the public health care system. Can the minister speak to the fact that these tests are not being covered, but for these are patients who have valid Medicare and need access to care? And has the department considered bringing all nurse practitioners and other healthcare providers into the public system so that they can bill Medicare and have that option to be able to work within the system?
Through you, Mr. Chair, to the member opposite. That's exactly what we're trying to do, is to bring our nurse practitioners that are practicing privately into the RHAs so that they have the same privileges on an ongoing basis, and more importantly, that people off of our Patient Connect are connected with a primary health care provider on an ongoing basis. And right now, that's not the case. So we need to bring all of these, fill these vacant positions so that we can continue to provide that primary health care access, and that individuals would not have to be paying a service fee outside of the Medicare system to receive the care that they should get covered by Medicare.
Thank you to the minister through the chair. Can the minister speak to what the obstacle is, and in terms of recruiting nurse practitioners to work within the system, and in some cases recruiting doctors to work actually within the RHAs? Some would like to practice outside of that and are able to, whereas nurse practitioners aren't. Can the minister please speak to what these barriers are and what the Department of Health is doing to deal with that?
through you, Mr. Chair, I'm going to hope that I can answer this as comprehensively as the member might like, but certainly welcome for follow-ups. So we've had 22 net doctors this past year, and doctors work within our public healthcare system. If there is a physician that might have a private element to it, let me use the example of a plastic surgeon. So many of the services could be provided by the Canada Health Act, but there may be other plastic surgeon procedures that are not covered by the Canada Health Act, and so that physician would be having partly a private practice. Nurse practitioners in the province are relatively new, and we graduate about 14 every 2 years. And so, you know, we've done quite well retaining the nurse practitioners that we have. We have to do a better job at keeping those graduates here, so that affording that opportunity. But I think the most important element to the answering to this question is that we are tasked with providing dependable, affordable health care. And that has to come through a managed system. No matter how much we don't want health care to be viewed as something that needs to be managed, we do have to manage it. And the 18 positions that we have vacant in our public healthcare sector would go a long way to not only unifying but solidifying the services that our people in this province need. And so nobody should be paying out of pocket for a Medicare-covered service. And that's really the point we want to drive home, is that we believe that the people of New Brunswick deserve to have a consistent primary caregiver. And that's why we need them to come into the RHAs.
Through you, Mr. Chair, thank you to the Minister. I guess I want to, I would agree people shouldn't have to pay for health care. And unfortunately, we have had many situations where people have to pay for their health care services, and that continues to this day. People have had to pay, in some cases, for abortion access. People often have to pay for their mental health care. I would argue strongly we need a pharmacare program nationally, because people pay for a lot of medical supplies and medications that they simply can't afford and end up rationing them. So I would agree people shouldn't be paying out of pocket for their health care. I'm wondering why we can't have nurse practitioners able to bill Medicare when they are providing these services. And yeah, I'm not talking about the plastic surgery type services or things that wouldn't be able to be billed under Medicare, but if they're seeing a nurse practitioner as their primary health care provider, why wouldn't they be able to, the nurse practitioners be able to bill for those services rather than people paying out of pocket?
Again, through you, Mr. Chair, I'm going to go back to our Patient Connect list and the thousands of individuals who are on those lists. And we know that if someone wants to operate privately, there's probably reasons for that. We get it. But the fact of the matter is that we have to provide affordable, dependable health care. And that means not cherry picking your patient list. That means everyone gets a fair shot. Whether you can afford the $30 or $50 fee for going to a private nurse practitioner to have something looked after on a one-time basis, or whether you can afford that and you're sitting on a patient connect list waiting for a provider. So we have to ensure, government has to ensure that we make every attempt possible to create a fair playing field for everybody. So we know that nurse practitioners want some flexibility. We've made that very clear to the RHAs. We want that flexibility offered, whether it be if someone doesn't want to work full-time and they want to work part-time, if they want to work evenings as opposed to days. Of course, that flexibility needs to be there, and we've given that directive. Virtual care. Virtual care certainly can't go anywhere. We've proven during COVID how valuable it is. And so, so it has to be part of it. But we have 18 vacant positions in our nurse practitioners positions throughout the province. And 16 of those, for sure, would take 1,000 patient connect patients off the list, fairly, so that everyone gets a shot at it. And nurse practitioner fee-for-service doesn't exist anywhere in the country. There are other models, and we certainly look at them, and we're certainly willing. We have salaried clinics, which is a model in Ontario, and so we're willing to proceed with those. But we must have accountability, and we must seek to have a fair playing field for every citizen in this province, so that they can have access to a primary caregiver.
Through you, Mr. Chair, thank you to the Minister for her responses. I'm aware of my time ticking, so I want to ask a few more questions. In the budget, there were some significant increases under public health program services and under community health services. I'm wondering if the Minister can speak to what those two line items, what types of services they provide, and what those significant increases are going towards.
Mr. Chair, through you, trying to maximize the member's time, so I'm trying to push for her too. So the public health program services, you're right, had a 54.5% increase. The majority of that is the high-dose vaccine for seniors and the COVID response and vaccine distribution. So human resources with regard to COVID vaccine distribution and the distribution in itself. And under community health programs, the 13% increase is largely attributed to hospice care.
Okay, thank you to the minister. There's also a line item which is just specific to COVID-19 pandemic. Can you just clarify how that's different from some of these other COVID-related items?
Line is for the actual COVID response, and it's one time. The other line is a line that will be ongoing for COVID response.
Thank you to the minister for the clarification through the chair. I wanted to ask about public health. I think that this past year has highlighted the immense importance of having strong public health institutions, strong public health funding and staffing. And unfortunately, we've seen in the past public health be divided up and kind of spread around. We've seen, and unfortunately right now, we're kind of at half capacity in terms of the regional medical officers of health. And at the same time, in addition to the COVID-19 pandemic, there are a lot of issues that are really important that are impacted in terms of public health. If we look at crystal meth, we look at opioids, we look at this unknown disease that is in New Brunswick. I'm wondering, can the minister, through the chair, speak to if this budget provides adequate funds and resources to deal with the multiple demands that are on public health at this moment?
Through you, Mr. Chair. So public health has had 13 new positions created. 8 of those positions are to support the medical officers of health. I want to use an acronym, but just in case people don't know what it is. So to support their senior program advisors, to support the medical officers of health, and also positions to support the neurological cluster issue, which we are ongoingly dealing with. When you talk public health, I always think upstream. And I'm a pretty big supporter of upstream and prevention. And as you've noticed in our mental health and addiction 5-year action plan and the Icelandic model, and looking to preventative measures within our communities, it's very important to me, and so we'll be supporting those ongoing and looking at them to see if we're going to get the results we need. We know that that's a longer term payback, but it's more than time to start investing there.
Thank you, Minister, through the chair. There are many questions on my sheets here that I won't get to ask today. But I do think it's worth me asking one more question related to prevention, which the minister just spoke about. I think that is one of the most neglected parts of our healthcare system and systems, and yet one of the most important. Can the minister speak a bit more specifically about how much money is being allocated towards preventative health care in this budget?
Through you, Mr. Chair, to the member opposite. I could just weigh in that certainly part of the engagement sessions that we're holding throughout the province, of which we've got 41 complete. We have six plus left, a couple of others besides the 6 that are public. And upstream has been a big part of the conversation. And so I'm pleased that within this budget, there's the $550,000 contract that will go to support the Icelandic model with Planet Youth. We have another $596,000 that works with the opioid and addictions file, supports needle exchange. We also have healthy families and babies with $300,000 there. My assistant deputy just told me that breastfeeding programs have been very successful. We're at 82% of our families, of our moms are breastfeeding. That's pretty significant. I didn't realize that. That's a new number. And also money towards the cannabis and youth protection files.
Thank you, through the chair, to the minister. I keep finding more questions that I want to ask, so I will try to make this my final one. And this is specifically tied to Clinic 554 not being able to offer certain services at this point, and I'm wondering 2 questions. Have the RHAs reported back on increasing abortion access in the province, and how much money is being allocated towards LGBTQ+ healthcare services? Thank you.
I thank the member opposite for the question, and through you, Mr. Chair. So we have a primary healthcare access committee that works with to promote the caregiving of all vulnerable sectors, including First Nations and most certainly the 2SI LGBTQ plus community. And I'm happy to say that we've actually been having some focus on this, because we recognize that these patients take more time. We recognize that there's ongoing monitoring that needs to happen. And so actually, when I first came to the department, it was one of the questions I asked staff because of our nurse practitioner clinics that we were opening in St. John, Fredericton, and Moncton. And I asked, could we not have nurse practitioners trained to service this? Because I don't think it should ever be in just one zone. I think it should be throughout our province. And so that is my vision, is that we will work with our primary caregivers, but also we have also brought into this committee, we have, maybe subcommittees, if you'll call it, but certainly we're touching base very, very frequently with a psychologist here in Fredericton who is well immersed in the LGBTQ community, as well as a UNB prof and a family physician. And so we're working on understanding how these services need to be delivered and trying to fulfill that portion. Now, there isn't any specific amount to this, because for us, it should be part of our primary care budget. And that's the premise by which we're going forward. But those meetings are regular, and I hope that I feel confident that we're certainly making some headway. And my vision is that it's not just in one zone. We have it throughout the province.
Thank you to the Minister through the Chair for that response. I would agree that primary health care and healthcare services should be available throughout the province, in the different corners of the province. And so I would agree in terms of 2S LGBTQ plus healthcare services. I would say for abortion services, I would say for midwifery, which is right now just in one spot here in Fredericton, and there is a wait list. I checked from personal experience, I know that. And so I hope that we can see these types of services be available more broadly across the province. I think that's very important. I would like to say that I guess I want to thank the Minister and her team for answering my questions. I always wish I had more time in estimates, but alas, that's I've already used more minutes than I wanted to. I would have liked to see more funding in terms of mental health care. I do think that there's still a gap there, and I think the Minister did acknowledge that it's not as high as it needs to be. But again, thank you to the Minister and her team for answering my questions this morning. Thank you, Mr. Chair.
Thank you very much. I guess at this time we'll recognize the member from Miramichi. Just